they do not understand
I
and encourage me to stop doing saliva test. I was surprised because I didn't know there was any other way than saliva.
exactly. I know because you've been my patient for how long.
Yeah.
But that's the problem. That's what I'm saying. I've been doing this for 30 years. I've been doing it for 30 years. I have 30 years of patients I've seen it work on. And I tell patients, I tell you, I can't remember the last time when the patient walked in and there was any inkling that she had a hormone problem, that the saliva test didn't show it.
Yeah.
I can't remember a patient walking in my office, me thinking that they needed a saliva test and it came back normal. I,
Yeah.
I can't even remember it in 30 years. I can't remember.
Yeah.
And here's what I did. I just did this video today. And I had somebody on TikTok trying to debate me. And I said, look, unless you are an OBGYN, I'm not even going to debate you. And even if you're OBGYN, I'm not going to debate you. I said, all I want you to do is show me one patient who walks in with fibroids, endometriosis, irregular bleeding, any hormonal problem, and show me an abnormal blood test on that patient.
Oh.
It does not happen. And that's what happens. They say, oh, well, these blood. So I put in the excuses. The excuses are, oh, well, these blood tests, they're just a snapshot. Your hormones are changing all the time. And so we're not going to worry about the blood test. We're just going to go by symptoms. That's the craziest thing that I've ever heard is
Hmm.
that suppose I manage your blood pressure based on symptoms. So if you had a stroke, that means that your blood pressure was too high. If you fainted, that means it was too low. So nothing else do we go on by symptoms except women's hormones and men's hormones. And they're telling you to stop doing saliva testing. That's crazy.
Uh-huh.
And how could I go through an OBGYN residency and never draw blood on patients? Because the textbook says that Abby, have you seen the textbook, right?
Yes, I have.
And
Yes.
it says serum measurements of steroid hormones gives you limited clinically useful information.
Correct.
And it's straight in the textbook. That's why we never drew blood. But this is what I'm saying. When I was doing this 30 years ago, no one was doing it. It was not popular, not at all. 20 years later, now everybody wants it. So all these doctors jumped into this this arena and they don't know what they are doing.
Oh.
Don't. And so here's the deal. Here's how here's how the standard of care is established. Is what are most reasonable physicians doing in your area? So if most physicians are drawing blood, that becomes the standard of care. It's the epitome of the caterpillar line. Whoever is doing one thing, everybody else just follows behind it. And it's crazy. Instead of Miss Wesson, I'll tell you, most of the things that I have done in my practice in the last 20 years has been because a patient has asked me a question that I did not know the answer to. But instead of telling you don't do it just because I don't know about it, I say, wait a minute. That sounds reasonable. Let me go and investigate it. And I will tell you, even looking at saliva testing, it's because a patient came to me and said, "Hey, do you know anything about this?" She gave me a tape. I listened to it. I really didn't listen to it. My wife listened to it and said, "I think this could help me." That's how I got started. A patient told me about it. So I doctors who don't listen to their patients, they're missing an education. Because when I went through medical school, they told me that the patients are going to teach me. And that is exactly what happens. Yes. I don't listen to the news. I don't involve myself with chaos because when your mind is cluttered like that, you can't fulfill your purpose because you're too distracted. And I'm so focused on this purpose, I can't even look at sports anymore because I don't want to be distracted sitting for 4 hours watching a football game. I look back at my life, I'm like, how much time did I waste doing stuff like that? So anyway, I keep saying I got to stop. Abby, do you have a question? Do you have a question?
No, I don't. I mean, it just shows how passionate you are about the information that you're trying to dispense, and that's great, really. I mean, you
Yeah.
know,
So real
it just speaks a lot to how passionate you are about what you're trying to teach everybody and the legacy you're trying to leave behind. That's all.
yeah, yeah. And I'm trying to tell people you can be passionate. You have something that you can be passionate about. That's your purpose. And if you're not passionate, then you're probably not living your purpose. Because when you find your purpose, you get passionate. I'll tell you, 20 years ago, my passion was understanding hormones, and we wrote those books. That was my passion. We wrote those two books. I was like this when we were writing those books. And that's what's in my mind. I'm like, I remember feeling like this before. I'm like, what happened? Me and my wife, we created those two books. When you get passionate about things, you want to create something,
Mhm.
you know? So I'm creating this because I'm so passionate about it. And how can I get it out? And it used to be in books, it used to be going off and speaking, but now it's social media. So I've got to learn the social media. And so, Abby, I know we'll have our talk tomorrow at 1:30 and we can get in more details about medical stuff.
Yes, we'll be there.
Okay, so I'll see you at 1:30 tomorrow. This will be recorded, and so we'll go from there. But yeah, Miss Weston, start out with sacred geometry because I think
Okay.
it has like 12 or 13 different episodes. But
Okay.
yeah, so look at that and let's talk about it next week, okay? Whatever.
Okay.
Okay?
All right.
All right then. All right.
Thank you.
All
Bye.
right. Thank you. Bye-bye.